Hello and welcome to Health Matters on Channels Television. Thanks so much for joining us. I am Mary Alale Yusuf. Sickle cell disease is a group of inherited red blood cell disorders that affect millions of people worldwide. In Nigeria alone, about 150,000 babies are born with a sickle cell disorder every year, many of whom die in childhood from complications of the disease. The Nigerian sickle cell burden is the heaviest in the world, about half of the total sickle cell burden. Fortunately, there are interventions available today that can and do give sufferers longer and more comfortable lives. With us today is Dr. Akinshete, Dr. Annette Akinshete. Dr. Akinshete is a public health practitioner, a fellow of the Medical College of Public Health, and the National Director and CEO of the Sickle Cell Foundation. We also have Dr. Olushola Oluwoshelu, a consultant hematologist at the Lagos University Teaching Hospital, a lecturer at the College of Medicine, University of Lagos, and a bone marrow transplant specialist. You are welcome to the show.
Thank you, Mary. Thank you. Thank you for having us.
Let's kick it off. I'm sure in Nigeria, most people by now have heard about sickle cell disorder, but how do children get it?
Good. Thank you, Mary. You got it right in your intro. You said it's an inherited disorder. Absolutely. It's something we get from our parents. And the fundamental problem is in the blood, and specifically is in the red blood cells.
Okay.
There's a substance in the red blood cells called hemoglobin. I don't like to use that big word because we've been in trouble before.
But I know that carries oxygen.
That substance carries oxygen. But in people who have sickle cell disorder, sickle cell disease, there's a tendency for their red blood cells to take a different shape from the normal round shape and become sickled. You know what a sickle is? A sickle is
like that instrument that you use in the
harvesting implement.
In the farm, yes.
Okay, some people like to say it's like a letter, the cells are shaped like a letter C or like a banana. Whatever the case may be, the fundamental problem with sickle cell is in that red blood cell. The cells have the tendency to change shape when there's a stress to the system, like an infection. And what happens, it becomes rigid. The cells become rigid, and they don't live long. Normal red blood cells will last 120 days thereabouts in the blood, whereas in a person who has sickle cell, those sickled red blood cells don't last more than 10 to 20 days.
So he has to keep producing.
Absolutely. That's why there's a shortage of blood. Like I've said, the fundamental problem with the condition is in that cell, and that's why there's anemia. Sometimes we say sickle cell anemia, and that refers to those who have the sickle cell, what we call homozygous, when both parents have, both genes are present in that child. Okay, so in a nutshell, sickle cell disorder is inherited. It is not infectious. It is not a biku. I say this, it's not because recently we went for an outreach program in a rural area, and I still get it. I still got it from the people that they believe sickle cell was abiku.
That's the child wants to die and come back and keep dying and coming back.
Some have other names like aromolego. Others contradict and say that aromolego is arthritis, and that speaks to the pain that they tend to have, because pain tends to be the hallmark of this condition. So that's, in a way, sets the stage for us to say that sickle cell disease is an inherited condition. It is not an infection. You don't catch it. And that's one of the things we want to raise awareness about, and to debunk the myths that surround this condition.
Does the sickle cell sufferer have a kind of look, an appearance?
One thing I want to know, Mary, we don't call them sufferers anymore. Okay. We want to be positive
Those
about
living with sickle cell disorder.
I like to say that we who live with sickle cell disorder, we who live with sickle cell disease, and because they're living better now. Gone are the days when people would say sickle cell was a death sentence. So much has happened now in the past few decades, so they live longer with good treatment and early diagnosis and good treatment. So they live longer, and some, I can tell you, have some 80-year-olds,
80-year-olds, yes, 60-year-olds. That means their lives are not short. They're probably longer than some other people's lives.
I'm not saying it's a stroll in the park, mind you. It's not a walk in the park. However, with good treatment, with early diagnosis and good treatment and proper management, they can live long, healthy lives. That's what I would like us to talk about.
What usually would end the life of somebody with the sickle cell disease? Is it the pain?
No, it would be the complications, and I'm glad we have Dr. Olushelu here, who's a hematologist, to talk to you about the complications, a myriad of problems. You can imagine that a condition that has to do with the blood, all systems in the body will be affected. So that in many ways, you tend to have organ damage, because remember that cell that has that abnormal shape, it doesn't have the capacity or capability to move smoothly and freely through narrow blood vessels. So there's a tendency to clog, to block blood vessels. They gather and block blood vessels so that blood does not get to end organs. And what happens? They're starved of oxygen. And when that happens,
begin to die.
Yes, and then what the body tells you, the body's way of telling you that there's a problem is pain.
Okay.
And so that's why I say the hallmark of this condition tends to be pain. But more importantly, those organs are starved of oxygen and they begin to have problems. So any organ in the body can be damaged.
Dr. Olushelu, can we put a name to some of the conditions that...
some of these
complications that these people have?
Yes, thank you. In sickle cell, the complication they have can be what we refer to as acute, and it can be chronic. The acute, as director has said, we have where the individual will be presenting with pain in the bone, pain in the joints, and we have what we call acute chest syndrome. It's a very devastating, of course, it's a serious problem, and it accounts for maybe 20% deaths we record in
just the acute chest syndrome itself?
Yes, acute chest syndrome. A situation where the patient will present to you with fever, chest pain, cough, and difficulty in breathing. It's a very serious case. Of course, they have what we call stroke. Some of them have weakness of the limbs, and before you know what is going on, they collapse and they die.
I'm a bit surprised that you mentioned fever.
Yes.
As one of the symptoms that they come up with.
Yes, in acute chest syndrome, you can have fever as a presentation.
Would that be as a result of infection or something? Do they get infections?
Yes, they get, especially when they are still young, infection is the cause of acute chest syndrome in them. So, infection on its own is a complication of sickle cell anemia or sickle cell disease. And it's a problem. If you don't manage it well, from when the patient is maybe is giving birth to probably 5 years, you don't put them on vaccination, you don't put them on prophylaxis, penicillin. Of course, from time to time they'll be having all sorts of infection, meningitis, pneumonia, and so on.
Do parents have to wait until some of these symptoms come up before they start bringing the child to the hospital? Is it possible to just start preventives from the beginning?
That's where can I come in? This is one of the things we're pushing for now, because in countries like the UK or even America, where they don't have 1/10 as much sickle cell as we have, like you pointed out in your intro, Nigeria is the country with the highest burden of sickle cell. They have what we call newborn screening. So at birth, parents know at once that their child has sickle cell. And so they institute treatment measures, preventive treatment measures that prevent those conditions that kill them. Those are the infections Olushelu is talking about, for instance. This is something we're pushing for in Nigeria. In our Sickle Cell Foundation, we have the National Advisory Committee, and one of the things they've advised and recommended is that Nigeria must have a newborn screening policy. Because remember, when babies are born, you can't tell the difference. You can't tell a child who has sickle cell and from a child who does not have sickle cell. They only begin to manifest symptoms and signs when they get to about 6, 7, 8, 9 months.
But they have been suffering before that time, haven't they?
I wouldn't call it suffering, because remember that it's something we call fetal hemoglobin. Okay. When you are in the womb, in your mother's womb, there's another kind of hemoglobin that's just as efficient as the usual hemoglobin A that everybody has, most people have. It's very efficient, and for them, it lasts them a period of time until it begins to wane though as they grow older. So by the time they get to 6, 7, 8, 9 months, it has waned enough for the symptoms to begin to show up. Okay. And that's when...
Let me quickly take a break at this time. We'll take a short break and come back in about a minute. Stay with us.